What do you think is the future here? Are you focused on con repeal, or is there other things at the local level you're looking to do?
I'm focused on con repeal. I'm also focused on getting law enforcement for these open records. I think it's so important for us to be able to access the records. It should not take me as a citizen and, thousands of dollars, possibly tens of thousands of dollars, because I'm sure they can afford to bury somebody in paperwork, to try to just see behind the curtain of the hospital that our community owns. Our board that is appointed by our city council that owns and governs that hospital, we should be able to ask those questions and we should be able to get those answers.
Does the media care at all about that aspect of it? Because it seems to be something that the media generally comes down on the side of transparency.
Americans are capable of achieving extraordinary things when they have the freedom and opportunity to do so. This is American Potential.
Hey everyone, and welcome to the American Potential Podcast. I'm your host, David Fromm. When you start a career, you put in the time, you build up your skills, all with the hopes of moving up and earning more. But what happens when you've done all that you're supposed to do and you still get paid less because of something the state has put in place? That's the issue today's guest ran into. But instead of accepting it, she pushed back. She got involved and started helping others to do the same. I want to welcome to the podcast Dana Hollifleld, who has been a nurse for over 20 years. Dana, thanks so much for joining us.
Thank you so much for having me. I really appreciate the opportunity to share my story.
Cool. Yeah. Well, tell me, starters, where are you coming to us from?
I'm coming from Huntsville, Alabama. My husband's retired military, so that's where we ended up. He works at of course, Redstone, but he served over 20 years, and that's and coming home for us because our family's originally from Tuscaloosa.
Okay. So, and you guys obviously moved around a lot. What other states did you live in? And were you a nurse while you were making those moves?
Yes, I was. I have to be honest, when I finished my nursing, I thought I was going to have my plan laid before me and go to Emory and get my nurse midwifery. And that didn't happen when he went active duty. So we first moved to Wyoming. And I will be honest, I had to look it up because I didn't know where it was. So got there, had lived in Alabama all my life. So that was quite a shock to have snow in June. And then we came down to Tennessee. We went to Florida. We went to Virginia, Massachusetts, Indiana, back to Florida, back up to Virginia, and now back to Alabama.
Wow.
And I worked as a nurse everywhere.
Yeah, so I feel like that probably gives you a really interesting perspective, and I'd like to come back to that. But first, just tell us why you decided to get into nursing and then maybe what areas you've worked in.
Well, I started out in an emergency room and while I was in school, and I just had a strong desire to help people. I feel like I'm a problem solver. I like to find resources for folks, especially maternal child seems to be my area that I like to work in. I love helping families, and just knowing that you're helping people to find the resources they need and to be healthier and stronger and better. It's just what makes me happy.
That's great. Well, they say you never work a day in your life, right? If you're doing something that you love.
Yeah. Yeah. I love working with my patients. That just makes my day.
That's fabulous. Yeah, I hope more people consider that. I mean, it really is such an important part. I get to host a podcast and talk to interesting people like you for a good part of my job, so it makes me pretty happy.
Yeah.
So you moved around a lot and worked in a lot of different hospitals. I mean, can you guess how many hospitals you've worked in as a nurse?
Let's see. DCH, EMS, Baptist, Huntsville, Crestwood, that one. Probably about 8 or 9, if I'm thinking right.
So when you think about all the different states and hospitals that you've worked in, your current, how does your current situation compare, or maybe even more generally, when you see how things are regulated or run, what does good look like, and what does less than optimal or bad look like?
Mm. Well, the areas that have been good, like for example, when we were in Virginia, we had a lot of different options. We had a lot of different facilities that we could go to and different doctors groups that we could choose from. And then when I came to Huntsville, I found that there's a monopoly. They own everything,
Mm.
uh, even doctors' offices. So your choice is very limited. And that choice is in your healthcare, that choice is in where to work, um, the specialists that you're able to see. It really limits a lot of different things.
So you found that the availability of options uh, is probably one of the best factors to better
Mhm.
care and just a better experience.
Right, and I think better outcomes because when you
Hmm.
have a monopoly, there's less competition. So, ironically, the outcomes are not as well, here as other areas that I've lived in.
So in past episodes, we've talked a lot about certificate of need laws, where uh, the government can basically, or a board can basically say whether or not certain healthcare facilities can be set up
Mhm.
to basically limit competition amongst the different companies, which ends up creating monopolies in a lot of places. And we've always focused on it from the patient standpoint, like getting better outcomes, having choices, having competition. But
Mhm.
it also impacts nurses. Can you tell us about that a little?
Oh, it impacts anybody working in healthcare, absolutely. It uh, stagnates wages. They can suppress wages because there's no competition. It limits your ability to go anywhere else if you find that your ethics and your uh, goals aren't matching that organization. Where are you going to go? I'd have
Right.
to travel out of state or to Birmingham to work for another. Yeah, down as far as Coleman and Birmingham to work for another.
Yeah, I guess typical monopolistic kind of activity where the market's not a real market because people
Mhm.
aren't being allowed to compete. Um,
Right.
so what's the real world impact where you're at in terms of
Well,
limit?
when I got here, so for example, when my husband found out he was transferring here, I was actually coming from Auburn, Opelika, and Montgomery, which are in Alabama.
Hmm.
And when I started discussing my wages, it was about 25% less than what I was making already in Alabama, if that gives you any idea. So you're talking about some of the lowest paid healthcare workers in the entire US. And I was like, how is this possible? What is going on? This is supposed to be Huntsville, Alabama. This is supposed to be growing. We have scientists, we have engineers. I would have thought we would be, top of the market.
Right.
And so I started doing some investigating and I found out that the hospital is actually owned by the Healthcare Authority Board of the City of Huntsville, which is a government board. So I started going to the meetings and encouraging others to go to the meetings. And by December, we had enough people in that room asking questions that for the first time in years, they got $3 an hour raises. And so I ended up going to what at the time the only other hospital, which was Crestwood in Huntsville. It was not owned by Huntsville Hospital,
Hmm.
but they acquired it as of last month.
Oh,
So, yes, so no more options. And a lot of the folks that went to Crestwood went there because they had worked for Huntsville or they didn't want to work for Huntsville Hospital because they wanted to, they wanted to have a choice and a little bit higher pay, to be honest.
so what would so this is a basically a government owned hospital, right?
Correct. Yes. And we started asking questions about, for example, the CEO's salary should be open records. And according to the state law, it is. But in the state of Alabama, there's no law enforcement that I found
Mm.
out for open records. So I'd have to take them to court to get that information. And it kind of goes with the con laws. It's like they use these loopholes and these things to basically have control and to, you know, limit the choices of our community, limit the choices of uh, care, where you work. It limits revenue within the community. I mean, I could go on and on about all the different things that it limits. Uh, right now, one of the things that I was looking at, we don't have, well, we have birthing centers in the state of Alabama, but only two. And the they're wanting to put them under hospitals and require them to go through these con laws. And so basically, we have some of the worst maternal child outcomes. We need these birthing centers. We need this option in our rural community. And so these con
Mhm.
laws are limiting that. And I feel like that's part of the issue. It's like a lot of different pieces that have created this circumstance that we find ourselves in.
So you got active, started going to the meetings. You got other people to go to the meetings too. Um, how have you? What kind of action have you seen as a result of that? And
Well,
then,
we got the $3 an hour raises,
yeah,
and that actually carried over to Crestwood and to, I believe, the rehab centers. They ended up having to um, raise their wages, which lifted the whole community. And so I was very happy that that worked out, especially for a lot of folks that were really having a hard time making ends meet.
and then we've talked a lot about certificate of need or con laws. Um, have you been involved in a movement to try to get those
Yes,
repealed at the state
I have.
level?
I have. I have been talking to my state leaders. I know Dr. Larry Stutz has been trying to repeal some of those, especially for the rural communities, to
Hmm.
at least make it easier for us to get health care in those areas. When you look at the con laws, and I believe there's 47 requirements that they have on the ones here, it's just it's long, it's complicated, it's bureaucratic, and you just have to wonder, why would anybody want to come here and go through all of that? And then you've got the larger hospital monopolies that use it to basically restrict who can come in, to restrict their competition because they have a say in that process.
Yeah, I mean, we see the certificate of need laws all across the country, and there have been some wins in different states where we've got them repealed. The
Hmm.
AFP has been pretty active in a lot of those, but it's hard because those hospitals, the huge hospitals, hospital associations, are sometimes some of the most powerful
They
political
are.
entities in the state. I mean, they
Mhm.
they carry a lot of weight. Um, it's a
They
tough
they
opponent.
do. Yeah, and one of the things that I've tried to do is talk to different groups. I'm a nurse, so I'm trying to help nurses to understand how repeal would be helpful. I'm trying to talk to patients and help them understand that if we can repeal this, it's going to open up options for your care and hopefully help to improve those outcomes. Talking to some of the physician groups, nurse practitioner groups, I think it's gonna take a united, group to go up against that giant, so to speak.
Uh, when we talk about how there are better outcomes when we have more competition. We don't have the certificate of need laws. Um, what are some practical ways that you think, if there weren't con laws, that we might see better outcomes because of more competition?
I think we would have more outpatient facilities. Like I said, the, resources perhaps with the birthing centers.
Hmm.
Um, I think we would see more standalone facilities, to do testing and things like that so that people don't have to wait so long and they don't have to, sometimes be admitted to the hospital unnecessarily.
Yeah, it
'Cause
makes sense.
anytime you can get back home, I feel like most of the time people do better at home than they do in a hospital.
Well, I know this is your area of expertise, but talking about birth and just maternal health, I happen to be the father of a lot of kids. I've had a lot of kids, and I'm very familiar with birth. And we chose a number of different options, but that was the point: is there was options. There was a lot of ways things that we could decide to do,
Mhm.
and I think that that's so important to better outcomes because you can make it fit, in
Mhm.
this case, what's right for that woman.
Exactly,
What's going to make her the
exactly.
most comfortable, put her in the best situation. Because I think how comfortable a woman is probably goes a long way to how successful
Mhm.
birth is.
Oh, yeah, absolutely. We want to decrease stress. We do not want to increase stress. We want that person to feel comfortable. Uh, that is one of the hardest things we ever do. And so I think giving people choices and having options is so important. And for them to feel like they have a sense of control.
Yeah. Well, tell me about a little bit about the Huntsville. I mean, you got kind of a mega hospital there, right? Like one
Yeah.
entity. Uh, what's it been like to deal with them? Because when it is a monopoly, they don't really have to deal in customer service. What's it been like to deal with them, and like, what are some of the things you found out about it?
Well, I've had people come and tell me stories, and then, just uh, personally, I mean, uh, I found that there's these fees, and I'm still trying to figure out what some of those fees are that they kind of tack on. So I don't think there's as much transparency. I don't feel like there's as much oversight and
Mhm.
accountability. Um, it- to be honest, Crestwood, since it was a private owned hospital traded on the SEC, there was more transparency because of the SEC uh, rules and regulations than with this nonprofit public owned hospital.
Yeah.
And they paid close to $500 million to purchase Crestwood Hospital. And, I think about the ceiling that was leaking when I worked at Huntsville Hospital, Mother Baby. And I'm like, how is it we can pay close to $500 million, but we can't fix the leak in the ceiling?
Yeah. Good point. So, what do you think is the future here? Are you focused on con repeal, or is there other things at the local level you're looking to do?
I'm focused on con repeal. I'm also focused on getting law enforcement for these open records. I think it's so
Yeah.
important for us to be able to access the records. It should not take me as a citizen and, thousands of dollars, possibly tens of thousands of dollars, because I'm sure they can afford to bury somebody in paperwork to try to just see behind the curtain of the hospital that our community owns. Our board that is appointed by our city council that owns and governs that hospital, we should be able to ask those questions and we should be able to get those answers.
Does the media care at all about that aspect of it? Because it seems to be something that the media generally comes down on the side of transparency.
Well, I do have a national story that was done, and I have been, steadily every opportunity trying to get that story out there. And slowly but surely, I feel like it is. As a matter of fact, Dr. Diaz, that's running for the federal Senate seat, has really brought to light a lot of these issues as well.
Well, that's great.
hmm So I think just a lot of different people bringing it forward, and it appears to be a lot of healthcare folks that are basically speaking out. But part of the problem too is that folks are afraid. These hospital monopolies can blacklist you. And you're talking about being able to feed your family and take care of your family. I completely understand if you're too afraid to speak up.
Yeah, what made you kind of initially go out there and speak up? I mean, there's risk to you, right? Your
There
employer and
is,
your
there,
community.
there, there is. I felt like I was in a position, and I hope it doesn't sound the wrong way, but I mean, I felt like I could afford to speak up.
Yeah.
Uh, you know, um, I could take that hit and speak up for other people. So that's what I did. And so far, so good. I've been able to get a few things changed, and I'm still steadily working at it. Every day I wake up and say, okay, what are we going to do today?
Yeah. Well, good luck on the certificate of need repeal. Hopefully, are you guys targeting that for the next legislative session?
I am. I actually have been trying to get in touch with my state leaders.
Hmm.
Like I said, Dr. Larry Stutz. And I'm trying to get in touch with I believe it's Senator April Weaver. She's a nurse. Just trying to reach out to those folks that I feel like will understand the need to repeal this. And it's also, as I was doing a little bit of research, it's my understanding that with the rural health care transformation program with CMS, it's incentivized for them to look at that and to try to, tear down those barriers to expanding that care. Because these con laws can bury things for years. And we need these resources right now. We don't need to be buried in bureaucracy, taking years when the house is burning down right now, so to speak.
Yeah. Well, Dana, I wish you the best. I give you a lot of laudits for stepping up, being courageous, kind of speaking out when maybe some of your colleagues didn't feel like they were able to do that, and staying after it, because they do try to, with a lack of transparency, we see it in local government all the time. They try to just wait you out, and it's really frustrating. So if you're resilient and you're resolute, sometimes they gotta, because you got the law on your side. So
yeah, and just being persistent and polite. I try to, every chance that I get to talk to my state leaders, to thank them, because I know that is a very difficult job. Serving the public, but I do want them to understand how important this is, and the opportunities that could be there if we repealed these laws. I was looking at the information in Florida, and they've actually had a boom since they, repealed their con laws in, expansion of different healthcare entities and businesses. So I feel like it could definitely be a positive. I think the data shows that it could be a positive if we do this.
Well, I appreciate you leading the way. It's great.
Thank you. I appreciate your time, and thank you for the interview. I appreciate you listening to my story.
Well, we love to feature people who are out there, just regular folks.
Yeah.
Doing the right thing and trying to make a big difference. If you're one of the impetuses behind, certificate of need repeal in Alabama, that's a pretty great thing to have achieved in your lifetime. So
yeah. Well, my kids, they're always like, "Mom, what are you up to? What are you doing?" And I hope one day they'll appreciate what I've done.
That's awesome. Well, and hopefully there's a lot better, there's a lot of moms and kids who have a lot better outcomes, kids who get to live a great life, and moms, same things, because you fought this fight.
Yeah, that's what I tell my kids. I said, sometimes we have to be the one to speak up. We've got to be the one to stand there and, just do what we've got to do.
That's great. Well, thanks for joining us. Really appreciate it.
Thank you. I appreciate it.
If you like this episode and would like to stay connected with the podcast, be sure to like and follow us on Facebook, Instagram, and YouTube. And always remember, liberty and freedom are easily taken for granted. Don't take them for granted. Go out there and defend freedom and liberty. Thanks for joining us, and we'll see you on the next episode.
Thank you for listening to American Potential. You may listen to more stories from Americans working every day to expand freedom and opportunity in their communities by visiting AmericanPotential.com.